activity could be anything from doing a marathon to doing a brisk walk on a trail in a forest preserve in Illinois. It doesn't matter what you do, but it does matter that you do it. I had a gentleman that came in today with polymyositis, and that's a college of vascular disease, almost like fibromyalgia, where the body is attacked. All its muscles and its insertion points on bone are attacked by white blood cells, and they stiffen up and cause a overall body ache, difficulty with activities of daily living, and all the other symptoms that come with that. Depression usually, and a couple other things. So the objective with that person is not to get out and do a marathon, it's just to get out and do something. So again, the activities that I suggest with a lifestyle change or embarking on an anti-inflammatory lifestyle can be something as easy as meditation, can be something as easy as breath work. If you look at my other videos on meditation, beginning a meditative breath work exercise, you'll see what I mean. But for the purposes of suggestion and pushing the envelope with activity, I just want people to get out and do things. I really think that if you are well-rounded with your reading, if you investigate a lot of literature as far as activities, then you'll know and you'll have a good idea of what you might be interested in. If you are of the mindset that exercise only includes lifting weights, then you're at a very big disadvantage, because if that's all we have to do for exercise, you're going to hurt yourself, especially if you have chronic disease. The objective of making a lifestyle change anti-inflammatory wise and living to a long, healthy life is to have something that's sustainable. Pumping iron isn't sustainable. Certainly have some guys that will embrace that form of exercise, but it helps with regards to getting out to the gym and building up muscle. It helps with regards to having big muscle. It doesn't really do much for the relaxation part or the longevity part. I think there's other ways to do it that don't involve paying an expensive gym membership and utilizing an hour of exercise a day and 15 to 30 minutes of driving one way and another 15 to 30 minutes of driving back. That's about 2 hours a day. That's not sustainable to my average person that works 50 hours a week. So sometimes it's just as easier to get out and do calisthenics. For that guy that I mentioned, the guy that suffered from polymyositis, he's on a very strong medicines from his rheumatologist, and even with this acute flare-up that he came to see me for, calisthenics like push-ups and sit-ups would flare him up, so we had to do something easier. And with the mindset of my average 40 to 50-year-old guy, walking in a park is not exercise. Yet I challenged him and said that it is a form of exercise. I think regularity over the course of 30 to 90 days will prove its benefits at the time that you tolerate that 90-day mark and you don't flare up your disease, and you now embark on adding exercise with weights or adding some kind of resistance exercise. It's very important, depending on who you are, to always have a coach behind you. I always talk about coaches, I always talk about exercise physiologists, trainers, chiropractors, to help watch over and make sure that you get an outside opinion as far as how to do a specific activity, what body parts to use, what type of activities would be better for you. If you, again, are well-rounded with your reading, you might be able to come up with a couple things on your own experiment. If you're at the point where you have chronic disease and anything flares it up, you're going to run into a brick wall because of all the pain that you suffer from because of these experiments. So it might be nicer to decrease the experiments that cause pain, or it's called push crash, and you just ask for specifics from a doc and or a person that is well-rounded with their experience in having patients start up with a personal program of exercise. Exercise physiologists actually take the concept and go into college with several years of studying the body, studying disease processes and how the two relate together. So I think you get what you pay for when you go into the realm of seeking out an exercise physiologist. Not to say that personal trainers are bad or yoga instructors are bad. I think that sometimes you have to invest in the maximum bang for the buck. So pick the brains of the people that you're going to be using. try to experiment as much as possible. Get out there into just some form of a routine. Doesn't matter how intense, but a routine. Now, everything I just said with regards to polymyositis and or fibromyalgia, people with chronic pain, doesn't match with the guy that's a marathon trainer. If you talked about a marathon trainer and I say hike in a forest preserve twice a day for 10 minutes, that's not going to jive. That too is non-sustainable, because the mindset with avid athlete is going to be push the envelope. And for that person, I might again come up with a personal program, but something on a routine basis that does not cut into activities of daily living, relaxation, that does not cut into sleep. So again, everybody's a little different, but as long as we start or embark on a process of something that's sustainable, that we enjoy, that won't flare up a disease process, and that will help in decreasing heart disease, cholesterol, poor sleep, insomnia, hypertension, then that's the ultimate goal for an activity, or embracing an activity that is good for you.